Community Connections with West Michigan Leader from the corner office, and I'm looking around this office, and there are a lot of corners, but the corners look so brand new that I'm not sure where to start. Congratulations, Jessica, as you have just relocated, actually added a new location to your existing PT clinics. Congratulations.
Thank you very much. Yeah, this is our 8th location, and we are in Kentwood, Caledonia area, and we're excited to be in this part of town.
Do I dare ask, are you busy? Are people needing the services of physical therapy?
Yes, to answer your question, there are a lot of people that need to access physical therapy, and also a lot of people that probably need physical therapy that are just finding out that physical therapy can help their needs.
Yes, all right, so before we take a little walk around your clinic, basically it's, do I dare say it's one room with maybe a couple of conference
We do.
rooms?
We have a private treatment room, and then we have a pediatric corner over there because we do like to see our pediatric patients here. But otherwise, we just like open gym space to do exercises and to have a lot of space to move around.
Who needs physical therapy? Are you mostly for rehabilitation? Are you going to work on my knees and back and neck and elbows and wrists?
Yes, all of those areas. We also see people with headaches. I am a vestibular therapist, so I specialize in treating vertigo, post-concussion rehab. There's a lot of other dizziness syndromes that I will treat. So it isn't only orthopedic injuries, and we also see babies and children with developmental delays and torticollis and plagiocephaly, brachycephaly. So we see a lot at this location.
What makes your center unique?
That's a great question. I believe we have a lot of great staff to cover all of the specialty areas. We know you can't be an expert in every area, right? So we have a lot of great resources, and we really value continuing education. So we are up to date on a lot of the newest therapy tools like dry needling, and we have access to aquatic therapy in some of our locations. Our Cascade location, as well as Walker, they have pools. And we pride ourselves in providing really great quality care. We track our outcomes using an outcome measuring tool, and we have some of the best outcomes in the country.
Do we call this a treatment mat?
It is. It's a pediatric treatment mat because it's nice and big, so we can get our little babies on here, and they have lots of room to move around.
Let's present a case scenario. Bring me a diagnosis to the table.
So we're working with a baby with torticollis.
What's that mean?
It is, in lay terms, the baby's neck muscle can be tight, and it can create an imbalance in their head. So you might notice that can create a change in head position or anomaly in their head shape.
Yes. So there would be some mat exercises and some stretching.
Yeah, so depending on the age of the baby, if I was working on a 4 or 5 month old, we'd work on tummy time.
You have a 4-month-old.
I do have a 4-month-old, so I work on some of these exercises at home.
Yeah.
I get them on the ball here, and we work
This
on.
is a ball, right?
This is our little peanut.
Yes.
For these
It's
babies.
inflated.
It is, and we get them on their tummy, and we would get a little rattle, or we have a lot of toys in here.
Well, and that's important to keep your clients, no matter what stage they are. There we go.
Ball or rattle.
No matter what stage they are. All right. Give me a little rattle sound here.
So here's a little rattle. And maybe this baby only looks to the left, and we want the neck to look to the right and strengthen that way. So we get them in this position, and then we can make some noise, some tuning, and work on their range of motion that way.
How important is it that you involve family members with this exercise?
It's extremely important because we want moms and dads and caretakers to be able to do this at home with their children.
Yes. And then a typical therapy session would last how long? For how many days?
With babies, it depends on how long we can keep their attention. We try to aim for 30, sometimes 45 minutes, but we take what we can get with babies. With adults, around a 45-minute session is very typical.
Yes. Now, as I continue, we see a treadmill. Obviously, there's a stationary cycle. How much do you incorporate, say, an aerobic exercise regime into a patient's protocol.
And almost every patient, we want to get patients moving. That's our main goal. Get them moving within their capabilities. So some patients, their goal is to run a 25K, maybe the riverbank run. And other people, maybe they just want to walk from their house to the mailbox. So it just depends on what their goal is, but always we want to get patients up and moving if we can.
Do you work with other practitioners, say occupational therapy, speech therapy?
A good question. We are growing our occupational therapy program. We do have one occupational therapist in our company currently employed at our Cascade location, and we are just now growing our pediatric occupational therapy program here at this new location in the Kentwood area.
How do you measure success? How do you know when it's time to discharge your patient?
It is a successful session in physical therapy when we are meeting the patient's goals. So on day one, we ask, what are your goals in physical therapy? Because it doesn't matter what I want for them, if whatever their goals are, once we reach them, and we ask periodically, every visit even, are we meeting your goals? Are we seeing improvements? And so that could be, a 1 week, or it could be over 3 months. So it just depends on where everyone is at.
And in this great new setting, I imagine maybe some of the patients get to know each other, right?
Oh, they do. I love that part of treatment when it's a community, really, of everyone coming in. We all are rooting for each other, and there's a lot of great conversations that take place here.
You're a manager, correct?
I am a manager, yes.
Let's go to your corner office. Remind me, do we need to see our practitioner, our MD, DO before we see? What if I need physical therapy? Can I come straight to you?
You can. So Michigan is a direct access state. With that said, some insurance companies do require a physician's referral for that to get covered. However, you can come right off the street and we can talk to you about your insurance and at least get you started with an evaluation.
Just get moving. What will be your style of management? What kind of leader are you?
That's a great question. I am a leader that likes to build relationships, especially with the community and the patients here. So I want to be someone that they trust, and if they have any healthcare question, maybe it's not something that I can help them with, but I can point them to another trusted healthcare provider. So I want to be one of a member of their healthcare team.
And yet, as a manager, you are also seeing patients. You're not just, I'll say it, stuck in the corner office.
No, I will be mostly seeing patients, and that is really what I love to do. But I will spend some time during my week getting out and letting people know about our clinic.
Well, again, this is somewhat of a be careful what you wish for, because the expansion usually does mean you're busy and you're serving necessary clients. But you can't do it on your own.
No, I have an awesome physical therapist that works with me. His name is Patrick Lawrence, and the two of us cover the hours here at this location, and he sees adults as well as he is an amazing therapist with kids, so he's a great pediatric physical therapist.
And full circle, take me back to the reason why you chose to enter this career.
I wanted to go into healthcare. I have a lot of healthcare in my family. My mom is a physician, and so I knew that I wanted healthcare, but I loved the movement sciences, getting people back up and part of getting their quality of life back through conservative medicine, movement, and exercise.